Alright. The first question is, nowadays PET-CT is used for lymph node staging in prostate cancer, and radiotherapy or node endocrine therapy are options for biochemical recurrence. Given that lymph node dissection surgery carries certain risk of complication, do you believe it is necessary for prostate cancer patients to undergo pelvic lymph node dissection?
So this year has seen a very big change in the EAU guidelines on pelvic lymph node dissection for prostate cancer. Previously, there was a strong recommendation that if we suspected patients had lymph node recurrence based on pathological criteria, we should offer a lymph node dissection. But this year, 2024, we have seen a very significant de-emphasis of pelvic lymph node dissection. So my view is very few patients nowadays should benefit from pelvic lymph node dissection, especially if they have had a PSMA PET-CT. So clearly, if you have a PSMA PET-CT and there's no evidence of lymph node recurrence, the predicted likelihood is much less, and those patients are very, very unlikely to benefit from pelvic lymph node dissection. This is one of the biggest changes we've seen in prostate cancer guidelines in the past 10 years.
Thank you. And the second question is, in clinical practice, which patient would you consider for PLND? Does PSMA PET imaging play a significant role in your decision-making process regarding PLND?
For sure, one of the most important benefits of using PSMA PET-CT in staging patients with newly diagnosed prostate cancer is it helps us consider whether patients might benefit from pelvic lymph node dissection. Last year, in 2023, we saw a new nomogram published in European Urology Oncology, which for the first time included the information from PSMA PET-CT. And what we clearly see is if a patient with intermediate or high-risk prostate cancer has had a PSMA PET-CT and the scan shows no evidence of lymph node metastases, then the nomogram significantly decreases the likelihood of lymph node involvement following PLND. What does that mean in clinical practice? Yes, it means that for us in Australia, where we do widespread PET scanning, if that PET scan shows no evidence of lymph node involvement, we do not recommend a pelvic lymph node dissection. I would say that in the last 10 years, the proportion of patients that I do surgery on in whom I do a pelvic lymph node dissection has dropped from more than half of all patients to now about 5% of all patients. So it's almost completely disappeared from our practice in the PSMA era.
Lastly, there is ongoing debate regarding the choice between standard PLND and expand PLND. What is your view on this?
So an interesting paper was published in European Urology at the end of 2024 from Memorial Sloan Kettering from a randomized trial comparing standard pelvic lymph node dissection with extended pelvic lymph node dissection. In the standard group, patients only had external iliac lymph node. In extended, they also had internal iliac and obturator. This was a negative trial. The trial design was to determine if extended lymph nodes would improve biochemical recurrence-free survival. And the answer was no. There's no benefit from doing extended pelvic lymph node dissection. So that's very important to remember, because there's another twist from that paper. That paper also did a retrospective analysis years later of whether there was a difference in distant metastases. This was not a pre-specified endpoint, and the choice of imaging was not specified, but they did seem to generate a hypothesis that perhaps extended lymph node dissection might decrease metastases. I believe that this is not a valid conclusion to incorporate in clinical practice, so my view is that regardless of the extent of pelvic lymph node dissection, there is still no benefit that patients benefit. And the most important thing to consider is, does anyone benefit from any type of pelvic lymph node dissection? I think if the PET scan is negative, the answer is no, very few people benefit. And that's why the guidelines this year have significantly de-emphasized pelvic lymph node dissection.
Thank you. Thank you for spending.
No problem. Is that good?
Could you please take a picture with me?